Good morning, Mrs. Jones. My name's Annie. I'm your nurse that will be looking after you today.
It is important to wash hands effectively to reduce the risk of transferring microorganisms to another person. Avogard is an alcohol-based hand rub that should be used before and after patient contact.
Okay, first I'm just going to take your temperature.
Make sure a clean cap is placed over the tip of your tympanic thermometer.
I'm just going to pop this in your ear. Is that okay?
Place the bit as close to your tympanic membrane to record your temperature reading. Wait for the beep to recall this reading. Reading should be between 36 to 38 degrees Celsius.
Okay, 37.2. Fantastic.
Discard the tip in the bin.
Okay, next is your pulse.
Pulse is taken on the wrist from the radial artery. Time is for 30 seconds and then times that by 2. Respiration is recorded at the same time. However, patients should not be aware that respiration is taking place. The nurse should take note of the rise and fall of the patient's chest, counting breaths for 60 seconds. Pulse count should be between 60 to 100 beats per minute and respiration between 12 to 24 breaths per minute.
Okay, fantastic. Okay, lastly is just your blood pressure. So pop some pillows under your arms. Okay, just relax your arm.
Taking blood pressure is important as it gives the nurse a starting point with their OBS and how frequently they need to be done. It is measured to assess the blood circulation in the body and also used to identify alterations due to disease processes or responses to medical therapies. Select an appropriate size cuff for your patient. Arms should be level with the heart. Place the cuff appropriately 2/3 of arm's length. Determine your baseline blood pressure by palpating artery distal to the cuff and 30 millimeters of mercury above the point where the pulse disappears. Locate the artery by placing stethoscope in the ear and diaphragm over the brachial artery. Slowly release the pressure valve, deflating slowly at a rate of 2 to 3 millimeters of mercury per second. Note the point on the gauge where the first clear sound is heard. The first is systolic, which occurs when the ventricle contracts, followed by a sound of muffling. The final disappearance of the sound is called diastolic. This occurs when the ventricle relaxes. A regular blood pressure range is 120/80.
Okay, fantastic. 110/70.